Hey everyone, it's Gregory from HEALTHline, and mark your calendars. September 24th and 25th, Glendale Adventist is sponsoring once again their CARE event from 7 a.m. to 5 p.m. And make your reservations today because seating is limited. Their mission is you and your heart health. What they look for is AAA, abdominal aortic aneurysm, ABI, ankle brachial index, carotid screening, blood pressure check, cholesterol check, stroke evaluation, registered dietitian consult, and one-on-one cardiologist consult. What are you waiting for? The good people at Glendale Adventist Medical Center care about you and your heart health. Make your appointment today.
I'm Suzanne Whatley with a news tip. Whenever I hear somebody complain about the smog, I want to say, you should have seen it when I was a kid. PE classes were moved indoors on smog alert days, and the smog would make my lungs hurt. Thanks to, yes, government regulation, the air is much more breathable these days. A new study concludes cars are putting out lots fewer smog-causing chemicals into Southern California's air. The federally funded report says that's due to the Southland's strict rules leading to cleaner cars and fuels. The level of many air pollutants is down 98% over the last half-century. However, ozone remains a problem. And if you have asthma or some related sensitivity, pay attention to air quality alerts and limit your outdoor activity on days when the air is predicted to be bad. Remember that a lot of what remains harmful can't be seen. I'm Suzanne Whatley, and that's my news tip for you.
Welcome back to HEALTHline. Tonight it's the conversation of prostate cancer. And did you know that about 242,000 new cases of prostate cancer will be diagnosed this year, and over 28,000 men will die of prostate cancer? Joining me tonight is urologist from Glendale Adventist Medical Center, Dr. Kamyar Ebrahimi. And earlier he said I can call him Dr. E. Doctor, before we ended the last break, you were just skimming the surface of erectile dysfunction and incontinence with men. Is there a connection with that and prostate cancer?
Well, prostate cancer in and of itself doesn't cause erectile dysfunction, at least initially, or urinary incontinence. However, some of the treatments, whether it's surgical or hormonal or radiation therapy, can result in erectile dysfunction. You also have to remember, prostate cancer doesn't happen in 25, 30-year-old, 40-year-olds. It happens in elderly, older men. You know,
statistically
45, 50.
Older men.
Correct. And
okay.
When you're older, you are going to have more problems with erectile function. So, are we causing erectile dysfunction in patients who have prostate cancer, or are they basically being pushed to have an earlier occurrence of erectile dysfunction because of the treatment of prostate cancer? That's the thing that you have to kind of recognize when you counsel patients also. The incontinence is definitely something that can happen as a result of the surgery, and most men until very late ages don't have any issues with that.
Doctor, what are signs and symptoms of prostate cancer?
Initially, the scary thing, Greg, is initially nothing.
Nothing.
You know, you could be healthy as an ox and be doing it just as well, having no pain, no issues, no blood in the urine initially, and you can have prostate cancer.
However, if there is blood in the urine, that is a big...
That's one of the signs that
flag.
Prostate cancer should occur, and if someone has blood in the urine, they should definitely see
call their doctor immediately.
Definitely.
Okay, so the average age to get tested for prostate cancer, what do you recommend?
So the recommendations are to get a baseline PSA, which is the blood test, at age 40, and screening should take place for anyone from the age of 45 on an annual basis, as long as they have 10 years or more to live.
Hereditary, is prostate cancer hereditary?
There's a hereditary component to prostate cancer, absolutely.
How does one keep their prostate healthy and strong?
So an adequate amount of sunlight, a good balance of potassium, all colors of vegetables, decreasing the fat in the diet, exercise. Those are the main things that are good for your prostate. But guess what? That's what's good for your heart. And I think I mentioned this last time we were here about a year ago. It's hard to define good advice for your kidney and prostate or your vasculature, because, you know, if you don't have a good heart, it doesn't matter if you have a great prostate, it doesn't make a difference. So I think following what's good for your heart is going to be what's good for your prostate and for your kidney. And that's, it's easier to remember. So what's good for your heart? Good diet, exercise, reasonable weight, and a little bit of sunlight. And in regards to exercise, we talk a lot about this on HEALTHline, is at least minimum 30 minutes a day. And also great sleep too, lots of liquids. Good sleep, stress reduction, for sure. Doctor, I have a question. Now we're going to start with our little true and false early right now with the doctor. So in regards to prostate cancer health, this is true or false? Watchful waiting is still a top option for the slow-growing cancer. Yes, absolutely. Prostate cancer treatment as a whole has watchful waiting or active surveillance as one of the arms, which means patients get periodic rectal exams and PSAs, and nothing else is done. No hormone treatments, no surgery, no radiation. Because, again, some prostate cancers, if not all, initially are slow-growing. So therefore, you do not have to intervene until there's evidence of progression. Number 2, surgery always causes impotence or incontinence, true or false? Not always, but when I consent a patient for surgery and I do robotic surgery, I tell them, the statistics that are out there, about 10% for each, but that's a definite real risk factor, and I would let them know that's one of the risk factors. Absolutely, it's possible, but risks are 10 to 15%. Before I dive into the next question, doctor, somebody comes in and they get diagnosed with prostate cancer. What is the protocol? Okay, so I always sit down and talk to them. I see a lot of patients for second opinion. If I wasn't a diagnosing doctor and they hear sometimes they end up in my office. I have no idea how, but if it's a second opinion, I tell them about all the options, even though they've probably heard it a couple of times already, which is watchful waiting. Watchful waiting, we just talked about it. Surgery, which is to either take it out open or robotic fashion. Okay. Radiation, and there's 4 or 5 different ways of doing radiation, either external beam, proton, tomotherapy, cyberknife, or brachytherapy, which is the seeds in the prostate. The other option is cryotherapy, which is freezing the prostate. Okay. That's not necessarily mainstay yet. I do quite a bit of, I have a lot of experience with cryotherapy, and it can be tailored for patients. So it all depends on where you land in regards to where your prostate cancer diagnosis is. It's a very personal discussion with the patient, and it's very much individualized. I love that you said that. Okay, when we come back, we're going to have some more questions for the doctor, and we're also going to address the questions that you asked us on Facebook in regards to men and their health. Do not go away. Hey everyone, it's Gregory from HEALTHline, and I decided to come out into the community and talk to you guys to find out what you do to stay healthy. Talk to me about your health and fitness. Do you work out?
No, actually, I don't work out at all.
So I have a trainer. Fantastic.
That's what keeps me in this trim shape at age 70. So.
You're 70?
Yeah.
Okay, whatever you're doing, I want.
I lift at the gym, and I also play basketball every weekend.
I try to dress the part.
You look the part.
To inspire myself.
Okay, so dressing the part to inspire yourself gets you in the game.
That's exactly what I did today.
I love that.
CrossFit, a lot of it.
CrossFit?
Yeah.
So how many times do you train?
About 4 times a week.
And what's your diet like?
It's all over the place. So some weeks is balanced, some weeks are off the deep end. So.
Actually, I eat a lot of junk food.
So you counteract it. So you work out, but then you eat junk food.
Yeah. For junk food, stay away from it. You can't do it. You can't eat junk food and stay healthy.
I try to stay away from fried foods. And sugary foods.
So you're conscious. You don't go to the gym, yet you walk a lot and you're very aware as to what you put in your body.
Right.
I try to limit my sugar intake.
Okay.
I go with a lot of vegetables, a lot of proteins. Okay. Try to eat 5 times a day. Probably try to get about 9 hours of sleep a night too.
So let me ask you a question. Since you go to both extremes, do you feel the healthier difference?
Oh, big time, yeah.
So what do you say to the person that really doesn't want to work out and know they should?
Get a trainer.
Get a trainer.
That's the best thing if you're lazy.
Okay, and if you can't get a trainer, how do you inspire someone?
You just do a little bit at a time, I guess.
So baby steps.
Yeah.
Go have fun, go play ball.
Keep at it. Put your shoes on every day and go at it.
I heard healthy choices, I heard unhealthy choices, I've heard boredom, and I've heard intention. What are you going to do to get your health on? Make a choice.